Hello.
Hi, good morning.
Good morning.
Hello.
Welcome to Baby Sprinkle 2021. Today we have Dr. Kate Ratliff with us from Grand Blanc Pediatric Dentistry. How are you?
I'm great. Thank you for having me.
Oh my gosh, we're thrilled to have you. We had a great conversation yesterday, you and I, about all the exciting things that happen when you have a child and they need to visit the dentist. And I said to you, and I shared it with Lindsay, every time we do an event like this or talk to an expert, I learn something new about the field that the expert is presenting. And I think that's awesome, which is why we do this event. We want to share and we learn too, which I think is great.
It's so important for new moms.
It is. And I know one of the things that we talked about, and we'll just jump right into like the top questions that you get from moms, is the first age that you're supposed to really visit the dentist. And I took my kids really late based on what we talked about. So maybe could we talk about that a little bit?
Definitely. And I wouldn't say you took them too late. I think that it used to be age 3 is when it was recommended. But now pediatricians, pediatric dentists, and even the American Dental Association, who represents all dentists, recommend age 1 at the latest. Sometimes we see them earlier, so at latest age 1, but 12 months is really the perfect time. But at our office, we see 1 year or 1 day olds. We see 3 months old. It kind of depends on what the needs, if they're having some feeding issues. But for their first evaluation, if they haven't been, 12 months is the perfect time.
Did you do 12 months? No, I think I did age 3.
So I took them when so I have 3 kids. I remember taking my younger 2 when my older ones had visits, just to kind of get them used to the office and kind of what went on.
Oh, that's a good point.
But we didn't do actual exams until like 2.5.
2.5. Okay. So you were before me.
But still,
yeah.
So my oldest, he has he's not great teeth. And I don't know if you hear that or if that's a myth or what, but all of my kids get the same dental care and his are just a little more problematic. And so I wonder if going earlier could have had an impact.
And it's always hard to say until we see a kid, but it's always important. A lot of it's truly education. If you compare it to like well-child visits with your pediatrician, a lot of it is the education, is the learning and slowly acclimating these kids to the dental world, because let's be honest, we're shoving our hands in their mouth and it's a new experience. Some adults have problems with that. So, we don't expect our littles to have, a different reaction. They're going to have the same reaction. We want to get them comfortable and happy and realize it's a safe place where people will take good care of them.
I think that brings up a really important point, like what you're both talking about. I remember as a kid being terrified of going to the dentist. Now, I did not have a pediatric dentist. I did not go to a dentist that had that specialization, but I think that is so wonderful because I too have 3 children. And yeah, it's nerve-wracking. It's a stranger at first. It's hands in the mouth. It's very personal space. And I mean, we know as adults how important it is, but I had a child who would like not unclamp her mouth. She refused. So yeah, an environment where they feel comfortable, I think, is wonderful.
What's important about the pediatric dentist is that the additional training a pediatric dentist receives is really in development of a child. So not only their anatomy or their airway, their mouth, their teeth, their lips, their gums, but also just general behavior management, or what to expect of a 6-month-old versus a 2-year-old versus a 4-year-old, because our engagement is completely different based off age, but also temperament of each child, and to be able to predict how a quiet child is going to react differently to the interventions that we do, or the more outgoing child is going to react differently, and that's important for a kid to have a good experience so they're not fearful for the rest of their lives.
That's so true. I love that. Yeah, even as an adult, not anymore, but as a young adult, I was afraid of the dentist.
It's not something you look forward to.
No, not at all. Not at all.
All right, so go ahead.
I would say it's just not always an easy environment for anyone. And so that's why we like to create that open, happy environment for our kiddos.
Oh, absolutely. It makes a huge difference.
It does.
So maybe before the first dental visit, when do you recommend that parents start kind of paying attention to dental health and brushing. And so what do you tell those young parents? What should we be doing with our kids' teeth?
It's a great question. At the latest, you should start brushing when the first teeth erupt or come in.
Okay.
A lot of times we encourage that you actually start introducing a toothbrush or even the little soft finger covers and just brush the gums. So they're used to that stimulating effect prior to the insult of having teeth come in and the experience of that.
That's actually,
and so,
yeah.
Yeah, and it's all preparation for a kid, and you want to, as a new mom, there's so many different things going on, or not as a new mom, as their second or third child, right? You have everybody else to take care of and the newborn. So if you can slowly integrate them into having that in their mouth, that's what we suggest.
Yeah, that's a great idea too. And that probably helps establish a routine, right? A routine throughout their lives and even with parents, like this is the time where you brush your teeth or you pay attention to your oral health. So
exactly. And just like an adult, we're going to recommend that you're brushing your kiddos' teeth twice a day. There's whether you're being bottle fed or breastfed, or when we introduce, solid foods or even puree foods, they all have sugar in it to some extent. So really making sure they're getting clean is going to be so crucial for their long-term health.
No, that I think kind of is a really nice segue into our next point. You and I had spoken yesterday, and I had shared with you that the first time I took my oldest child to the dentist, that he had 3 cavities, and I was mortified because I felt like I did a pretty good job, taking care of his teeth and kind of giving that a start. And you had mentioned that early intervention and really diet, when you start to introduce the food and the carbohydrates, like that's a really big deal. And it kind of changes how we care for the teeth. And it brings up a lot of really interesting points.
It is. So there are so many things we introduce. And let's start with whether a child is bottle fed with formula or breastfed. Both of them have sugars in it. And so it's important to acknowledge that exists. So the frequency in which we're feeding our kids, whether it being during the day at night, plays a huge part in their risk of cavities. From research, we know that kids that are breastfed up until age 12 have a reduction of cavities or risk of cavities. I said age 12, 12 months.
Oh, right.
When breastfeeding occurs after 12 months, and there's a lot of variables that go into it, but we start seeing a greater risk of cavities for these kids that are breastfed after 12 months. And I think I mentioned this to you yesterday. I am a breastfeeding mom. I'm currently breastfeeding my 8-month-old, and I did my other children. But and so trying to understand that breast milk has sugar in it. If you are continually feeding at a constant rate, or your child's waking up frequently during the night, we suggest trying to wipe off the teeth if possible, and or reducing the frequency of feedings at night. Because at some point, depending on the age of the child, and I'm referring to a healthy child, but they may not need those feedings anymore, depending on the age.
I think that's good to know, just to keep in the back of your mind also. Not really to change the feeding or to change, your habits, but just to have that knowledge, I think, is important.
Exactly. Yeah. I was explaining to Courtney, we get parents in at age 2 and sometimes 1 or age 3 with the range, of 1 to 3. And they're having early cavities, and there's nothing that necessarily that is altering versus the average diet, although they're frequently feeding at night and we have concerns. And so we try to help them understand if it's breast milk or if it's a bottle. We really encourage that if you're not breastfeeding and you're bottle feeding, the child never goes to sleep with a bottle, because of the high risk of decay we see. Again, I'm referring to a healthy, well child, but and it's interesting because it translates to later on when your child's older and you're potty training. If there's a habit of having something at night, that makes potty training really difficult, doesn't it?
Oh, yes, it does.
Right. So, a lot of our early intervention, or the communication and education we provide the parents earlier on at these first visits, is relative to their teeth and health, but a lot of it translates later on to life, so they can easily acclimate to potty training, to good sleep patterns, and really setting them up for a good foundation.
Yeah, I think that's awesome. I love how that all relates. And I'm assuming you've worked with pediatricians as well in conjunction with pediatricians.
We do all the time. They're a great referral base for us, but a lot of it is just the support of these early and new moms, and how we bring up those healthy habits and behaviors, and keeping good lines of open communication for the parents, so they don't have so many times of bouncing back and forth between us.
Right. I think that's great. And we had talked about this yesterday. I had my oldest son had his tonsils out, and the first person to alert me to that was the dentist. And my pediatrician at the time, it hadn't even been a thing. Like, it wasn't even mentioned that the tonsil should come out. So it was just so interesting to me that your oral health just affects so many other things in your body, and what that meant for him to really have, those need to come out because it's affecting your mouth and your sleep and so many other things.
Right. And their daytime behavior when it comes to sleep problems. There's a lot of kids that are misdiagnosed or show symptoms of ADHD and hyperactivity. And a lot of it is that they're not getting proper sleep. And so it's a great point, Courtney. One of the things we look at, is the teeth, but a lot of it is just the entire facial structure. We look at their airway, yes, their tonsils. We look at how their tongue is attached and the location of the tongue sits on a regular basis, because all of that plays a huge effect on their function during the day, but at night. And we want to set these kids up for a wonderful, healthy life. And we can catch those early if we're seeing the patients early enough.
Yeah, I think that's amazing. And you had mentioned the tongue, and we had spoken about it yesterday too. The tongue and lip tie, is that something that you address as well, and that you see a lot of? And how does that affect, nursing and all those things?
That's a great question. So very early on, we always work with our colleagues. So we always encourage that if there's having challenges with breastfeeding, we would like them to see a lactation consultant, because a lot of it too, as new moms, we don't know where to position this baby. And all of our breasts are different. All of our nipples are different. And we're getting into the nipple conversation. Sorry.
We're used to it.
Yeah, good. New moms, it's how we roll. But
Just another day.
Right.
So true. But some lip ties are very obvious. And if we see them early on, then we want to have that surgical intervention. It's a very quick procedure. ENTs will do it. We will do it. Other professionals will do it as well. We personally use a laser, but for what we find good, quick healing. But a lot of it is trying to acknowledge that and assist the mom to get quick relief if they're having pain. And so lip and tongue ties, if they're breastfeeding or bottle feeding, even earlier on at age 1, we recognize them and we capture them and try to help these patients learn different postural positions for their tongue and have a better success. Did they answer your question?
Yeah, no, I think that's great. And I was just thinking, as you were talking, we do have a lactation consultant who is also an expert panelist in baby sprinkle. And I just love how what you're saying is going to kind of, fit like a nice little puzzle into what she's going to talk about. And it's just so nice that we can share this information with our audience.
It is.
Well, it's so interesting how so many things really are at play kind of in little people. And I mean, like 12 months and under, I think it's just so difficult to be able, obviously they can't communicate with us in, like spoken language. And so it's so interesting to know. You just assume like, well, I have a good sleeper, I have a bad sleeper, but there are things you can do to help your not great sleeper become a better sleeper. And so I think for a lot of moms, that's really good news. I had good sleepers, but I need my sleep. And so I don't know how it is to function with a child that doesn't sleep. I couldn't do it. And so that's great. That's great news.
Yeah, I think so too.
And collaboration. No, I have a really bad sleeper right now, guys.
It's hard.
It is. Collaboration, though, between different specialties. So our lactation consultants and our pediatricians, the pediatric dentists, is so crucial. We don't just do the surgical intervention with a lip tie or tongue tie and say, see ya. We want you to
Yeah.
follow up with lactation consultant because there's still more to learn now that that kid's tongue is different position. And,
Right.
you know, I think for new moms, knowing that resources exist, you know, the resources you guys list for them is huge, and knowing that it's okay to reach out. You know, we work a lot with speech pathologists too, and we see some moms that are a little concerned about, like, oh, I don't want my kid to have to go through speech therapy, and I'm going to immediately tell them, oh no, that's the best. It's the best thing you can do. If a resource is offered, take it, because, you know, you will be so amazed how kids can raise to the level and just do so well with a little intervention or therapies.
Yeah, I think that brings up a good point too, especially for moms that are brand new. Like, I always say to my husband, like, I'm on my third rodeo with kids. Like, nothing is off the table. No topic's taboo. If there's an issue, I'm going to dive in and figure out how to fix it. But with my first child, like, you don't know what you're doing. Everything is kind of a baptism by fire type of thing. And to know that there are resources out there to help with an issue that might crop up, and that it's okay to ask. I mean, you know, there's so much information out there, and there's help available if your child is having any of these issues, you know.
Exactly.
Yeah. And that they're normal too. They're not like issues.
Keep in mind that you're not the first person that's ever had to encounter this. This is not the first child that's had, you know, XYZ going on.
Right.
And so I think it's important to talk about that. And because everybody's going through little mini battles, every milestone, every new stage just brings surprises. So
yeah,
it's important. Perfect.
I would agree with that.
Well, Dr. Kate, can you tell us a little bit about your office and where you're located and how we can get a hold of you?
Definitely. So our office is currently in Grand Blanc on Fenton Road. We have an amazing staff. All of the women that work for me, the majority of them are all moms. We take amazing care of kids, and we take pride in knowing that each kid comes in and we're going to treat them like they're our own. We are actually in the process of building a new office, and we're so excited about it because we're incorporating so many things that we wish we had as moms coming to the dentist or pediatricians into it. It's literally going to be right across the street. We've had the pleasure of working with Shannon Easter White or Funkatecture, and we've incorporated some great things in there. We have a nursing room for moms that fit a big stroller. And so we have a huge waiting room, and if moms want to be there, but sometimes it's nice when you have 3 kids and one's nursing and you're waiting to get to the dentist and you want to just have some quiet time of privacy. We have a room.
That's amazing. That is amazing. That is amazing.
It's better than nursing in my van.
Right? In your car.
Been there.
Yes,
I was pumping in the car when I talked to Courtney.
Yeah. We talked about that, how you pump in the car.
Oh yeah, it's a great time saver.
It is.
Hey, multitasking, right?
Yeah.
You gotta do it. But so the other features we have in our new office is we have a special room. We call it our infant oral room, but it's a room that doesn't have a dental chair, and it's a little bit more cozy. And so it's for our 1, 2, and 3-year-olds to come in to just be comfortable, where we'll slowly acclimate them to a traditional dental chair. You know, who wants to be bombarded by all these other lights and crazy things around them? So we kind of have little baby steps to get around there. And we're really excited for this to be built. We hope we're going to have it done by the end of the year. And we're going to open it up to the community to come and see and come
that's amazing.
Just engage in an environment that's opening and welcome to our little community members.
That's wonderful.
Yeah, I love that. And we had talked about, you're in a location that's very easily accessible. You know, it's a destination, it's right there, you know.
Yeah, we chose this location because it's easy to get in and out of, and you're not having to go through all these traffic. I mean, I know when I'm a mom and I'm getting out of a place, my kids are either tired or they're hungry, and they're in the back seat saying, "Mommy!" You know, I don't want to have to worry about crazy traffic and, you know, getting around things. I want to be able to go straight home, and we like this location for that. It's simple.
Yeah.
Oh, that's wonderful.
That's great.
There are places my husband won't go if he has to make a left turn.
It's true, right? It can be stressful when you get the kids in the back and you're multitasking, as we always do. But
that makes a big difference.
It makes a big difference.
That's great. We're really excited to hear about your new location and the new resources that you'll have.
Yeah, that's awesome. Where can we find you online?
So we're on Facebook and Instagram, but where we have a website, it's Grand Blanc PD as in pediatricdentistry.com.
Perfect.
And we really encourage that for families to go to look at our website, look at our social media, but give us a call. One thing that we love is just trying to have new families, new parents. Just we love to give information, and our office is available to our community. There's also great other pediatric dentists in the area too, and finding that right home for each family that fits your needs and expectations is so crucial. So we encourage you to pick up that phone, give us a call. My staff will spend all the time you need and answer the questions. It is a team effort at our office, and we love to have people come and see us.
Oh, that's great. And that really speaks to your passion for what you do too, which I think is wonderful. It shines through for sure.
Oh, thank you.
Yeah. Well, great. Well, this has been great to talk to you. I feel like we've presented a ton of information. You've shared a lot of really important things with us. Is there anything else that you would like us to know and share?
I think this is great. Again, I think open communication and having parents know that they have someone they can call and communicate with is my biggest message. Knowing that being a new mom is not easy. We are here for them, and know to reach out to the resources we have in our community. So, we're all moms. We've all been there, but each child presents a new challenge, and to utilize us or someone else. And thank you for you guys for providing this for the new moms or moms to be. It's important for our community.
Oh, thank you. We, the longer that we've done it, we just want to provide a resource that we wish we would have had when we had our first children. And that is our goal, to share the best of what our community has to offer, like yourself. So thank you for joining us.
Well, thank you. It was a pleasure.
Thank you so much, Dr. Kate. And we're going to follow along on social media, and we can't wait for your new office. And thanks for being with us for Baby Sprinkle.
And we will let you guys know where to find Dr. Kate. We will link your website and your Facebook page so people can just go ahead and find you online.
Excellent.